Good morning, everybody. My name is Gabrielle Stacey. I'm Assistant Director for Special Educational Needs, Disability and Vulnerable Learners here at Worcestershire Children First. So this presentation this morning is to introduce you to our guidance for Worcestershire schools regarding supporting children with medical difficulties, and this is part of our attendance and inclusion conference. We're very pleased to have you here today and appreciate that things didn't quite go to plan with the technology, so I hope these videos are helpful to you. It's really important today to focus on the different aspects which prevent children who perhaps are vulnerable and all children in general to attend school. Attendance and engagement is the bedrock to children's successful education, to ensure that they achieve what they can do, that they have those social opportunities to mix with their peers, and they prepare for their adulthood beyond their education. So it's great for me as Assistant Director to be presenting a colleagues from Education and Early Help today. We've only just in the summer brought together our vulnerable learners services, and we're already seeing that value of for our children in terms of the timeliness of ensuring that they receive their education in an effective way, and that we're able to track and monitor and intervene where those children are perhaps not receiving what they should. But this morning's presentation is focused on those children who have medical difficulties, including some of whom who will not be able to attend school full time, those who perhaps need periods of time off for appointments, and those who become unwell and need to receive their education in an alternative way. So this morning we'll cover a number of things in the session. We'll talk about what the law says for schools, what your statutory duties are. We'll talk about what Worcestershire Children First, on behalf of the local authority, needs to do in order to support this work, our statutory duties. We'll introduce you to individual healthcare plans, which many of you will be using already. This was introduced initially in the Children and Families Act and the subsequent guidance from the Department for Education out to schools. We'll also think about the role of individual healthcare plans for mental health difficulties and ensure that we have a good understanding of how mental health difficulties should be seen as a medical difficulty for some children. I'll then move on to what you need to do in terms of making sure you're compliant with your duty to have a medical conditions policy. This will include the management of medication and a little bit on how you might go about developing this policy with your school community. And finally, in the latter part of the presentation, we'll focus on how you secure good attendance for your children with medical difficulties and what to do if children aren't able to attend school. We'll also talk about part-time timetables and how to use those effectively for a very small number of children. And if you need to, how you should go about securing alternative provision and what makes that effective for children who are unable to attend school, either for a temporary period or ongoingly. This session is based on the pack that has been sent out to you as delegates for our conference. So you'll see that that has draft written across it, the guidance that you can see on screen now. That's because the email address, which is highlighted a couple of times throughout the document, just needs to be secured before we issue the final copy and needs to be checked for accessibility before it goes online in the next week or so. Okay. So there are two pieces of law which really impact on the work that schools need to do when working with children with medical difficulties. The first of which is the Equalities Act 2010. And I'm going to read from my notes at this point because the wording's really important. So all schools have duties towards children with medical conditions, many of whom are legally defined as being disabled. Governing bodies must make reasonable adjustments to ensure that children and young people with disabilities are not put at a substantial disadvantage compared with their peers. This duty is anticipatory, which means that adjustments must be put in place in advance to prevent disadvantage from occurring. The second piece of guidance, statutory guidance, which schools must adhere to, is based on the Children and Families Act 2014, and that was the guidance that led to the issuing of the SEND Code of Practice in January 2015, and the guidance later in the year around supporting children with medical conditions, both of which are key documents that need to be something that you frequently reference. So the supporting pupils at school with medical conditions overlaps significantly with what we're talking about today and our own guidance, but we've put a Worcestershire interpretation on what's in that initial guidance and hopefully made it a bit more practical for you to use as a tool to guide your practice day to day. It's really important that when working with your governing body that you have a named governor for this work. It might fall under SEND, it might fall under the work of your chair of governors or vulnerable learners if you have a governor focusing on that area, but it's really key that they both understand the DFE guidance and are aware of what the expectations are around schools, but also our Worcestershire guidance to know what our local interpretation and expectations are. Okay, so we'll move on to Worcestershire Children First. Our statutory duty for children with medical conditions are that where children and young people are unable to continue at school or to attend school because of illness, we are required by the Education Act in 1996 to provide them with a suitable education. Now, I'll come on later in the presentation to what that means in practice, when you might need to notify us of a child being unable to attend, and our practical way of implementing and seeing that duty through for most children, and what we might do in a smaller number of children who need something quite bespoke. The guidance that we've issued to you provides a template for an individual healthcare plan. As the lead for SEND, I have to be very careful with my acronyms here because of the number of children that I work with who have EHCPs. This is quite a different document. The law underpinning individual healthcare plans relates to those with medical difficulties and not all children with SEND with complex needs. This is a document that sets out your planning, your recording of the approach that you're going to take for an individual child. You will want to put together this document with parent carers, with the child themselves if they're able to do so, and with medical professionals. And what it covers, we'll go on to in a little while, but really this is a tool to help you ensure that you have done that anticipatory duty around the child's disability, that they are safe and thriving in school, and that you're able to communicate with your school community the detail of the approach that needs to be taken with any given child, and keep that updated so that the provision and support and care that they're given remains appropriate. So you can find the document as an appendix at the end of the guidance that we've provided. It covers a lot of the main things that you'd expect around the child and young person details and their family contact details, but just like to touch on a few of these just to stress some of the important things. What we find with children with medical difficulties is that often there needs to be quick and effective contact with families. And it's really important that you see the document as a live document and keep it updated. And you need to have a named person who takes responsibility for that. It's particularly important if you have a child where there might be an emergency situation, or where the family needs to be informed and to make about or consulted about a decision that needs to be made about the child's care, that you have up-to-date contact details and that you have a process for regularly checking with the school, that mobile numbers are appropriate, that you know who to call and when if parent or parents are working, and that you have an alternative if you can't get hold of people. The medical conditions policy that statutorily all schools need to have talks about how you store and manage medication in school. So we'll come on to that a little while later. in the IHP, you need to talk about how you will routinely monitor a child's medical condition, and that may well involve the child or young person themselves, depending on their age, their condition, and their ability to do so. What's really important and has been a consistent theme in my work in SEND and with medical difficulties is that often the issue with routine monitoring is that the arrangements don't cover situations which are outside of the norm. So it's really important that this IHP considers, yes, the day-to-day when things are, when the child is in class and they have their regular teacher or teachers if they're secondary age, but it also needs to cover those situations where the child is outside of school. So for example, if they're on a trip, if they're on a residential visit, if there is a supply teacher in the school, if it's under normal circumstances and not during the COVID pandemic, what it's like in Christmas week. So it's really important that situations don't arrive where the routine monitoring and response to a child's medical difficulties are missed because things are not as they normally are, and so that routine and habit isn't in place. The document covers the impact on the child's learning, and there are particularly high incidence conditions such as diabetes and epilepsy, which many of you will have in your schools and in your classes, where the child's medical well-being or physical health will directly impact on their ability to engage with their learning and be successful at any given time. So it's really important that you understand with the family and with the child and young person themselves what that impact is, and that you research using the vast array of information out there about what that can possibly look like. For example, with epilepsy, in the run up to a seizure or post seizure, there can be quite significant cognitive differences in the child's ability to process information, and that needs to be recorded about how that impacts directly for that child in their IHP. I've talked a little bit about situations that are outside the norm, but another of the situations in which we find when things go wrong tends to be around meal and snack times, particularly when these are unplanned for children with feeding difficulties, for example. And it's really important that this information about what happens when the curriculum involves food, when you have a child with medical difficulties, which impacts on their digestion, that you really do that planning ahead and consider the child's IHP when you're doing the curriculum planning. Examples are things like a child's birthday, when sweets are shared at the end of the school day, for example. Is it safe for that child with an IHP to be given a snack in the same way as everyone else? If it's not, what is your alternative for that child? What's going to ensure that they have a positive experience as part of your class? The IHP will also consider what off-site arrangements, if any, need to be made, what alternative provision is in place for that child. And we'll come on in a little bit to what that might look like and how you might, what your duties are around ensuring that that is a safe and effective learning environment for the child. IHP but also needs to cover how you will train and keep your staff skilled and accredited in some cases to meet children's needs with medical difficulties. It's really important that you also build in contingency into your training arrangements so that children don't end up not being able to come into school because only one member of staff has received the appropriate training in a medical intervention, for example, and that you have a backup plan, if not more than one backup plan, to ensure that they're able to access. And that requires pre-planning in around that equalities duty, that anticipatory duty, to ensure that those situations don't arrive when the impact of the child's medical difficulties is something that could be avoided. An IHP should be used for children who are experiencing significant mental health difficulties. We have just produced some guidance, which will be online in the next couple of weeks, around children with anxiety, as we know this is a group who schools are seeing grow over time, and the complexity of the needs and the impact of that anxiety continues to increase over time. The children who will require an IHP are those for whom perhaps you will see a significant impact on their learning, their socialisation, and perhaps where there are health professionals involved. Alongside the IHP, you might also want to consider a risk management tool for children who are experiencing and demonstrating self-injurious, self-harming behaviours, but also children where there has been any kind of suicide ideation or attempts to take life. A risk management approach produced in collaboration with specialist mental health services will be a really important part of the record keeping that you do. For other children, you might also need to consider an individual education plan or a provision plan, as with mental health difficulties, you would be looking to intervene and provide support and for the child to be working towards developing emotional regulation skills, self-management skills, which help them manage manage how they feel as they grow and they develop and they spend more time in school. Obviously, these plans will also consider how the school environment is adapted to meet their needs, and you might think about bringing these plans together in the IHP and in an adapted form to make sure that all the information is together. There's lots of resource out there to help you with that work, and you might start by looking at WCF's emotional health and wellbeing pages. We have a pathway document which provides guidance to school about how to support children. There's information in there about developmental norms, a list of assessment tools which you can help you understand a child's needs in more detail. There's advice about interventions, and there's also a lot of information, as there is in the medical guidance that we've produced and are talking about today, about the services that can help you. It's not all about specialist CAMHS. It can also be about, for example, those services that support with targeted work that can support you through consultation at school, or interventions such as CAST and Reach for Wellbeing, that it's really important that you know about and are using as and when you need that support. Alongside the guidance that will be available over the next couple of weeks about anxiety, we're also putting in some training for schools which will be advertised around the work that you can do to support your children with anxiety. And that will be run by our educational psychology team, so look out for that. So there is a legal requirement for all schools to have a medical conditions policy, and this policy again is one that needs to reflect your individual circumstances as a school. Sometimes what we find is that schools use a template document, and we'll come on in a little bit about why that might be an issue. Or they might be using a policy which goes across a number of schools as a multi-academy trust. What's really important is that that policy is co-produced with your parent carers and with your children and young people, and that your governor for this area is intrinsically involved in that production and then the reviewing of that policy. The reason the policy needs to reflect your specific arrangements within school is that these will be different in every setting, regardless whether you're part of a MAT, whether that's about how and where medication is stored safely, or whether it's who the named person is in school, whether it's about who and how you ensure training is put in place and what your backup arrangements for that are. It's really important that this is a bespoke document for your school. What I would also say about your policy is that it's not enough to produce it in the way that we've described. The critical issue with medical conditions is that the policy is implemented robustly, as with any of the individual healthcare plans. And when I say robustly, what I mean is consistently by all staff all the time, to ensure that children are kept safe and are able to thrive. Where things do go wrong, it's because of that communication of the policy, and the only way to ensure that that is in place is to have a regular process of review, not just reading the policy and seeing what's been changed, but doing those learning walks around the school, looking at case studies for individual children, seeking feedback from parent carers about how things are going, and not waiting until things go wrong and there is a complaint about something which could have been avoided. So in terms of policies, I took a look on a number of websites, so 4 websites for secondary schools, 4 for primaries, 4 middle schools in the last week. And you can see from the slides that we've covered previously that that policy needs to be published and it needs to be easily accessible on your website. Now, I'm pretty good at navigating school websites. I spend quite a lot of time searching for information around the work that I do, so I'm pretty good at knowing where to look. But in some cases, I couldn't find the policy online. What was clear to me also was that schools where the policy was online, in a few of those circumstances, it only fulfilled part of the expectations that are laid out in that 2015 DfE guidance. So the storage of medication, for example, the primary schools that I looked at, 2 had a full policy which covered all the expectations, but 2 had a policy that only related to the storage of medication, which means that those bits around training, those bits around communication, those bits around ensuring that the equalities duty, for example, is met, haven't been covered. In the guidance that we've provided for you, there's a lot of information about health services and how they can work with you, and you'll want to make sure that you are in regular contact with these services as and when you need around individual children, and keep yourself updated about the work that those services do to ensure that you're involving them as you need. But there's just 2 bits I wanted to pick up around early help and social care. What we know is that children with medical difficulties require a whole family approach. Often the impact of medical difficulties on parent carers is considerable in terms of their caring role, but also on siblings. And it's really important that you consider the whole family when drawing up an IHP. What you might want to do is consider an early help assessment where there are any kind of low-level concerns about a child, any welfare concerns, for example, around attendance, which isn't related to their health, as part of this whole family approach. And you refer to our guidance around early help when considering when and how that might be appropriate. This might involve the construction of a family plan. It might involve referral to family support services, early intervention family support or targeted family support. But likewise, it may just be around the school early help office themselves, or signposting to community support. The other bit that I need to talk about is that for many children who are classified as disabled, what the research showed us is that there is an increased risk of abuse for a number of reasons. And it's really important that when working with children with medical difficulties, you are aware of any signs of escalating concerns around their welfare or any safeguarding concerns. And based on the levels of need guidance, do talk to the family front door if you are concerned. It's also really important that you're aware, in a very small number of cases, there are risks and concerns about symptoms that may be fabricated or induced. There is guidance to the Working Together to Safeguard Children that talks about this as an issue specifically. The important things are to keep an open mind, and if you have concerns or suspicions that that might be the case, to not ignore them and to have a conversation with your colleagues about whether they also have those concerns, to make sure that you are checking out any evidence of medical difficulties with healthcare professionals as part of your policy and procedures, so that that is enabled to keep the child safe and that you've got that updated information. And where you remain concerned, you talk to the family front door. So moving on to the last part of the presentation, we have a statutory duty to make sure that children receive a full-time education unless a decision is made by Worcestershire Children First as their local authority representative that to provide that isn't in the child's best interest. And what that means is that where a child is unable to attend school for whatever reason for a period, that needs to be recorded, planned, and in many cases with children with medical difficulty, that decision made jointly. In most cases, it's straightforward for for the school itself to make arrangements for a child in order to support them in their regular full-time attendance. But if that child is likely to be away for 15 days or more during an academic year, and that can be consecutive or cumulative, then you need to let us know. And that's because under those conditions, the duty will transfer to us to ensure that effective, appropriate full-time education is in place. It may be that we agree with you as a school that you are well placed to provide that support, perhaps through an online package or some other kind of bespoke arrangement. But the important thing is that you let us know so that we can provide that support and can make arrangements if need be. For many of our children who are unable to attend because of medical difficulties, that involves a referral to the medical education team, who many of you will have worked with before. The MET is currently under review, and many of you may have seen the presentation that I shared recently and been involved in the consultation about our plans for the review. And in the next year, you will see some changes in the way we go about commissioning that team and the work that the team does. In a very exceptional circumstance and for a very small number of children, there may be a need for a temporary part-time timetable. So part-time timetables are only appropriate where full-time attendance can't be secured, and it's really important that they consider the need for alternative provision or bespoke arrangements for a child to ensure that wherever possible they're able to receive a full-time offer. Part-time timetables for children with medical difficulties need to be underpinned by medical evidence which demonstrates the nature of the child's illness, whether the child can engage in learning and what proportion of the week, the time scale that the medical evidence is relevant for, and what kind of alternative arrangements will be necessary. It's really important that you engage with your medical and health professionals in gaining that guidance and ensuring that as a school you are fully informed about what the situation is with that child, and that these arrangements are reviewed very regularly with the family, the healthcare professional, and with the child themselves. So finally, where you need to put alternative provision in place, it's important that you understand that if it's alternative provision that you have commissioned, that it's your responsibility to do your due diligence around ensuring that that setting is registered if appropriate. So that's around, there is guidance in the alternative provision guidance 2013 from the DFE, which helps you understand your the circumstances under which a provision must be registered, and we've understood from our feedback through the exclusions and alternative provision review that you would like more support as settings in having a list of local alternative providers and whether they're registered and whether they need to be. So we're working on that during this academic year. But as commissioners, you would want to be sure that the provision that is being made for your pupil meets their needs and it is achieving good academic and social and emotional outcomes. It's also really important, again, that you review the alternative provision regularly with parent carers, the child, and any health professionals if they are involved in the child's journey. And crucially, that the arrangements that you have made ensure that the child retains that sense of belonging with your school and your community, as for the vast majority of pupils, the journey will be and the plan will be for that child to return, and you want that transition to be as effective and supportive as possible, and for the child not to feel that is something which is either causes them anxiety because they haven't been in school for some time, or that they might have lost friendships, or that they don't know how things have changed since they've been attending. So that sense of connectedness and that child's belonging are key, as well as the statutory duties around ensuring that the child is safe and that alternative provision is effective. Okay, all I've got to say about the guidance for children with medical difficulties. I know that you will be receiving a link to pose any questions. Please do ask anything that you need to following this presentation and looking at the guidance. Look forward to hearing from you about whether it's helpful. We will review the guidance over time and take on board any feedback that we receive in terms of what more would be helpful. And thank you all for watching today.